Part of your job is to get people on campus and to operate and manage campus. Talk to us about how you do that in the middle of a pandemic.
My name is Tony Calcado, and I'm the Executive Vice President and Chief Operating Officer for Rutgers University. So we have been at this for quite some time. We have been dealing with the pandemic now since January of 2020, and by the time we got to March, we had to pull back and really send everyone home. And we immediately started to look at how do we bring people back. And what we thought would be a short duration turned into a year and a half, and disruption of 3 academic calendars. And the game changer was vaccine, quite literally. And once we were able to make the call, and we were the first university in the country. Ironically, we didn't do it to be first, we did it to be able to tell our students what would be necessary to come back.
What went into that decision, and how did you decide, okay, we're gonna bring all of our students back on campus this year? How did you get to that point?
We have a big community. We have a community of 100,000. We have approximately 70,000 students. We sit in the middle of 3 major cities. As we got to the end of December, and during December, and vaccine became available, we thought, wow, if that could only be a part of a tool in our tool chest. And there was a speech that President Biden made, I believe in February of this year.
We're now on track to have enough vaccine supply for all Americans by the end of July.
And we thought, we can make this call.
Did you have any people pushing back on that, any students?
So, interestingly, our student body did not push back on that, did not push back on that at all. It was my expectation that that would happen. Our parents and our guardians minimally pushed back on it. Most of the pushback has been from third parties that are really unaffiliated with the university. We made the choice of doing what we did because we felt it was the best way to keep our students safe. And I can tell you that as we opened the campus, we have 65,414 registered students. And of those, somewhere around what we call non-responsive, around 600. That gives us a rate that's bordering on 99%.
What went into ensuring that students were going to be safe again?
There is signage everywhere, in every building, on every door, throughout the building. Even plastic has been put in place where that's necessary. We've looked at all of our HVAC systems. We have a robust preventative maintenance program. We've made improvements where we could. We have a sanitation program where we sanitize between classes, how often we do certain high-touch areas. All of those things are in place, all the protocols are in place. On the health side, how you're feeling, we have a My Campus Pass, which means that before you come to campus, or if you're on campus, before you go into a building, it's a quick download, 5 quick questions. If you come up negative on those questions, then stay away. So we're not populating entirely. We still have a 6-foot distancing. We are still requiring that masks be worn. We were doing that when the rule changed, and now when it changed again. So we require indoors that masks be worn. Outdoors, it's not necessary.
So Tony, we were talking about in the event of an outbreak, what happens on campus? And do you think some of these changes are going to be permanent because of the state that we're now in with COVID?
So I think, let me start with this. I fully expect we will have cases on campus, and we probably will have an outbreak. We're realistic, we're prepared, we know that could happen, and we plan for the worst because that's where we need to be. What I know will happen in that outbreak is that because our students are all fully vaccinated, we have a better than 99% chance that most of that illness will look like what's now referred to as a COVID cold. So it'll be mild symptoms. We don't anticipate anyone would wind up in the hospital because of an outbreak on campus, because we've created this semi-bubble around it. Now, having said that, we have 19,000 beds in our system, and we're occupied to about an 80% level. And we did that on purpose so that we could quarantine students if we have to. And we would move them into apartment-style dorms. They could actually do their own cooking if they'd like. We would also be able to provide food. All of those things are lined up, ready to go in the event of any type of outbreak. So we've planned for all of those pieces.
Do you think that's a new normal on college campuses?
I hope
Or should
not.
be?
So I think that we have always had robust student health services. And I think it's important probably to realize or understand too that this vaccine is one more vaccine of those vaccines that were already required. So there were a number of vaccines already required. I think that there are most likely some changes that we will see as we move forward on a college campus that will probably be on the permanent side. We need to do things like be able to better manage the amount of people on our buses. They're still packed, but we need to realize that is the college experience. Congregation are what universities are built for. Collaboration is what they're built for. Our job is to bring that back. Our job is to give back to students. Bigger differences in how we handle mechanical structures, HVAC systems, how we do sanitizing, how, you'll see sanitizing stations now as a permanent piece. I think you'll see more in those areas than how we actually do instruction. We've looked at the data and the science since day one, which is why we never took the chance of coming back last September or last January for the spring semester. We not only have a community of 100,000, but if you deduct those 19,000 beds, that's 80,000 people that go home every day. And whatever happens here goes home with them. So it is our responsibility for the collective greater good in the state of New Jersey to make sure that we try and keep our people as safe as we can. And again, it comes back to vaccine.